Okay.
Hello.
Hello. I'm going to make you a co-host so you can share your screen if you want to do that. And then there's like 10 or so people in the waiting room right now. I'm going to let them all in and we can just get started.
Would you rather I share my screen?
Up to you. Do you have a presentation that you want to give, or do you want to just?
I can give a quick overview of Cigna Ventures if that's helpful.
Yeah, that would be perfect.
Okay. And I may have to, would you mind emailing
Letting
me
you in again?
the Zoom? Yeah, I need to.
Yeah.
If you can send it my email.
Yeah. Second. Okay. It should have just been sent. So people kind of trickle in over the course of the meeting. Because you're a co-host, you're going to get the notifications that like somebody entered the waiting room, but I'm taking care of all of that, so don't worry about it. But when you join on your computer, I'll make that a co-host, and then you should be able to share from there. But we'll, when we get started, I'll just say, this is Kwasi, he's from Cigna Ventures. He's going to give a little bit of an intro, launch into kind of talking about health tech investing. And generally the split is like, 25 to 30 minutes of presentation and then 30 minutes of questions. People do tend to ask questions kind of during the presentation though. So up to you whether you want to take those or if you want to leave everything till the end. It makes no difference.
Sounds good.
Cool.
Okay, so I'm going to join you from my computer.
Okay.
See you.
I'll see you in a minute. Are you guessing this is your 646?
Yes.
Okay, perfect. All right, I'm gonna pin your video or spotlight for everybody. And I'll let people in and then we can get started. Hi, everybody. Thanks for your patience. We're just sorting out audio and presentation difficulties here. But without further ado, I'm going to introduce Kwasi, and he will be telling us about Cigna Ventures and health tech investing. So Kwasi, I'll let you take it away.
Yep. Hi, everyone. Can you hear me?
Yes.
Great. Okay, just want to make sure. Hi, everyone. Nice to meet you all. I am sorry. I am terrible with technology. Classic VC move. But looking forward to this conversation. I guess I can give a quick intro about myself and then have a few slides about Cigna Ventures that I'll run through, and then hopefully we can have a discussion. But again, my name is Kwasi. I was born and raised in Ghana. I came here for college about 13 or 14 years ago, and I've been here ever since. Started off my career in investment banking at UBS Healthcare in New York, and spent 2 years there. Loved healthcare, and then continued to stay in the space. And I think one of the best advice that I got early in my career was that if you like healthcare, then stay in healthcare and do everything in your power to learn about healthcare. And so I kind of took that path and quickly pivoted from investment banking and just went deeper into healthcare, where I worked at the advisory board company that is a company that's now owned by Optum United Healthcare. Was there for about 2 years. The company ended up getting acquired, obviously, and went back to school to start a company. So I got my MBA at Yale, spent my entire 2 years working on a startup concept. As you'd expect, it didn't go as planned. And so around, I think about 3 or 4 months before graduation, kind of had a very true-up conversation with myself around what I wanted to do next, given that I hadn't been very successful as a founder. And again, I love healthcare. The one part of healthcare that I still didn't have a full grasp of was with health plans. And I had spent 2 years kind of in banking, mainly working with pharma, spent 2 years in advisory board, mainly working with hospitals and health systems and providers. So kind of felt like working with health plans would be a good fit. Loved kind of spending time with startups because I'd done a few projects with a few founders as they were trying to kick off and kind of launch their companies. And so started recruiting for VC roles, but mainly focused on roles that were going to give me a lot of exposure to meet with health plan executives and learn about how health plans think about the world. Got very lucky. I think I ended up getting a job about 2 months after I decided to do VC and join the Blue Venture Fund in Chicago. So Sandbox, as most people may know it, but the LPs, the limited partners, are the Blues. And so spent 2 years there, and then got one of the folks that I'd met during my 2 years at Sandbox left. He was with HCSC, which is probably the second largest Blue Cross plan. He left to go help build out the Cigna Ventures team, and so he recruited me to help him build out a team. And so I've been working with Cigna Ventures team for about 2 years now. So no, that's a lie. About 18 months now. So that's a quick 101 about myself. I'm just gonna pause to see if anyone has any questions before I show the Cigna Ventures slide.
I think you're good to go.
Let's do it. Okay, so let me share screen. I think it's this one. Hopefully I didn't share the wrong slide. Going back. Okay, great. Do you see it? Yeah.
Yes, sorry.
Yeah. So just like imagine this actually said June 2021 and not May 2020. But this is hopefully a quick deck. I'll go as a fund. So about 2.5 years ago, Cigna set up a fund. Cigna created a wholly owned indirect subsidiary called Cigna Ventures. It's Cigna Ventures LLC, and committed money to be the sole LP. And so the company committed $250 million in the first fund. And the goal of it was really to invest in companies that are looking to transform the healthcare industry, and really honing in on kind of focusing on areas where we thought we had a right to win, i.e. in areas where we thought we could help them grow, right? And so if a company is selling if a company is selling, it's creating, let's say, therapeutics, right? And there's no way for Cigna to help them be successful, that's out of scope for us. And so we really kind of focus on areas of healthcare where we think that we have some assets and capabilities. And so the way I would think about Cigna is that there are two kind of arms of Cigna. There's a health plan, which most people know about. So there's a commercial kind of employer health plan. There's the Medicare Advantage health plan. We used to have a business in our Medicaid that they recently sold on one hand. And then there's also the health services business on the other hand that mainly sells services to other health insurance companies and other providers, right? And so that part of our business is called Evernorth. So funny enough, similar to Optum and United Healthcare, Evernorth is actually bigger than Cigna, but then the Cigna has a bigger brand that is still kind of gets a lot more of the attention. But Evernorth has assets like Express Scripts, which is one of the largest PBMs in there. Another one called Evercore, which is the largest utilization management company. And it has another one called like Accredo, it's like a specialty pharmacy business. But so there's so many kind of different health services assets that sit within Evernorth that just serves other health plans and works with some of our competitors as well. And so our job basically is sitting on top and helping drive transforming the businesses on both sides of the enterprise, both on the health plan side and also on the health services side. The way we look at the world, kind of, and we've made this very broad intentionally, and the reason is because when you set up a corporate VC, the worst thing you want to do is to further make narrow your job, right? Because like it's already a narrow job, given that we only investing in companies that could be helpful with Cigna. And so the worst thing you want to do is to make it even more narrower. And so the three buckets that we spend time, there's like analytics and insights, and then digital health, and then care delivery and enablement. And trust me, every single healthcare services and IT company fits within one of these buckets very easily. And that's very, very intentional. The history of Cigna Ventures, I think this slide is very helpful because I think when the fund was initially created, not first lie, maybe 2 years before the fund was created, the way Cigna thought about investing was that initially they were primarily investing in other funds, right? So initially it was a fund of funds, and so Cigna investing in City Lights, Cigna investing in any other healthcare fund out there. And then selectively deploying money where we thought it made sense for us to deploy money. And then what they realized was that, so you pick any healthcare fund. Let's say I'm going to pick any one that everyone might know. Let's say Bain, right? Pick Bain Capital Ventures. They would raise money from Cigna. They would raise money from maybe 5 or 6 hospitals, and they'll raise money from so many other stakeholders. And their number one priority is then to make investments that enable Cigna to be successful and dominant and very innovative, right? Their number one goal is to invest in companies that generate the highest return for them, which makes a lot of sense. And so what Cigna realized during that 2-year trial phase was that we were investing in companies, and the strategic value that we were getting out of those investments was limited, right? Sometimes the fund could go for 3 years and maybe only invest in one company that was somewhat relevant to us. And so what they decided was that let's basically transition from that fund investing and then have a direct investing team. And that's what led to the fund that they created about 2 years ago. And they stopped the team. And so the way the team is set up now is that we have about, I always have to do this math, we have about 8 people on the investing side and about 2 people on the platform side. The platform folks know the Cigna enterprise so well. They have very, very deep relationships. And after we make investments, they help our portfolio companies actually get the full strategic value from the partnership with Cigna. And on the investment side, there are 2 managing directors, 2 principals. I am one of them, and then actually we're 7, and then 3 associates that support it. So that's how the team is set up. When we invest in a company, we can invest anywhere between 5 and 40 million. We try to deploy on average about $20 million in any investment, right? And so there are some times where we can go into a company, our first check-in might be 5 million, but then hope that in the follow-on rounds, we get a chance to deploy more and more money. There are some times where we go and bank with like 15 million. And so kind of, we cannot keep deploying 15 million in the same company, but maybe deploy $1 million and to kind of hit that 18 to kind of 22 range per investment. This is our portfolio today. You may recognize a few of them. I think obviously Omada is pretty popular. It's not popular, but it's bigger. Bowie had a lot of hype during COVID because they did some pretty good stuff. Last year we made I think 4 investments. So last year we invested in Datavant that actually got acquired about 2 months ago. Very, very good exit for us. We invested in a company called Ginger, which has also done very, very well given the mental health crisis that we've had in America for a very long time, but all of a sudden we all started caring about it 8 months ago. And then Octave is another mental health provider, but then unlike Ginger, they look more like a One Medical where they are building physical clinics. And then we invested, our most recent investment was a company called Clearly, which basically does, the whole idea is that we do a terrible job identifying who is at risk of having a very bad kind of cardiovascular disease or like a heart attack, right? When you go to see a doctor, we use a lot of risk factors that, to be honest, may not and usually does not even correlate to how bad it is, right? So like, are you, your weight and your blood pressure and do you smoke? All these risk factors that are important, but doesn't really give the doctor a good sense of how bad the patient's risk of getting a heart attack, for instance, is. And so Clearly, it's an AI-based software engine which kind of reads CTA scans and then basically tries to help quantify and characterize the level of plaques that a person has, which again, plaques are really the determinant of how bad your kind of heart disease risk is versus whether you smoke or not. So that's our portfolio. I'm just going to end maybe with this slide with Ginger. I think that's a good case study of how we've partnered with a company. So I think we made our investment in August. I thought it was June. I totally forgot. Yes, we made our investment in August and then spent about a year really working in our team, our platform team, Brent and Rachel, great people, and spent about a year really helping, trying to figure out how a partnership could look like. And then about 2 months ago, launched with them nationally, where one of the things that's more kind of innovative in our minds is not the fact that we are paying for the therapy sessions, but the fact that we're paying for the coaching sessions, right? And so one of the big problems that we have in kind of mental health is that we don't have enough therapists. And 70% of people don't need to go see a therapist, right? Most of us, and myself included, we're in that worried world bucket, and your boss is being, excuse my French, an asshole, right? Or you're going through something that doesn't require a clinician. And so one way to potentially solve this lack of the death of kind of clinicians is to make sure that the people are seeing the appropriate people. Is that someone like me isn't going to take time from a therapist, so that I can go talk to a health coach instead. And then someone who's actually really sick gets to go see a therapist or a psychiatrist. And so one of the things that health plans haven't done in the past and still don't do is paying for health coaching, for health coaches to help manage mental health disorders. And I think we did that for the first time on a national scale with Ginger, which was a very exciting kind of accomplishment for the entire team. But the way we think about it is that when we invest, our model works really well when we know exactly the problems and what Cigna wants to be in 10 years' time. And then we invest in a company that has a very strong strategic alignment that can help us accomplish that. And we do everything in our power to enable them to be successful. And then obviously we own a piece of them. And as the company gets more successful, we also get some financial returns out of it. And so the model works very, very well when we can extract both strategic value, like with Ginger, and also extract financial value, again, like with Ginger as well, where the company has grown exponentially since we made our initial investment in August. So that's it. I'm going to drink coffee for a second.
Thanks, Kwasi. Ginger is my particularly favorite example that you can give because it's also in my funds portfolio. So we got to see this from the other side of talking about how Cigna would be helpful. At a high level, could you talk a little bit about kind of different trends that you've seen in healthcare over the years that you've been working in healthcare venture, and like what do you think is getting the most attention now?
Yeah, I think that now, I mean, I'm gonna try and I think what's weird with healthcare, right, is that we all know the problems, right? We all know the top 10 causes of death, the top 10 causes of healthcare spend in America hasn't really changed significantly over the last 20 years. Same thing, right? The same things that unfortunately hurt us, same things that continue to hurt us. So we know the problem. We also know that usually we're like the Pareto rule, right? 20% of people drive 8% of the cost. That whole, right? So we've known all that. I think one of the things that we are starting to see a lot more is that employers have been a lot more aggressive overall with helping drive these solutions. And like mental health is one classic example where health plans knew that our networks were terrible, right? They've known this for about 10 years, 20 years. They just didn't care about it. And all of a sudden, employers took it seriously, and that kind of became a change factor. And now health plans are thinking about mental health for adults, right? And another segment of like mental health, which I know, Sarah, you all have an investment in, it's in the pediatric mental health space. We've all known that I think about half of the mental health cost in America is driven by people under 25 or something like that, right? 50%. And then a lot of times mental health actually the symptoms start off at age 12, 13, 14. So if you step back, mental health is actually a young people kind of condition to solve as old, right? Because if you solve it early, for most people, it doesn't get bad. But we've known about it, except that no one really cared. And then all of a sudden, there are 20 startups trying to solve the pediatric mental health problem, which is great. Another area where we've all of a sudden seen a lot of startups jumping into is in the oncology space, right? It's like oncology, again, big spend area. Pharma, biotech does a lot. There's always been a lot of kind of money going into oncology from a diagnostic perspective, because again, early detection really kind of drives ultimate outcomes. But from a care management, navigation side of care kind of services perspective, no one has really been very successful in driving outcomes in oncology. And all of a sudden, again, we are seeing about a lot of companies coming out to solve it, the problem in oncology. And then the last area that at least we are spending time and I am passionate about is in the women's health space. We, as a health plan, one of the things that we struggle with, right, as you all may know, is engaging with our members, right? I don't even like to engage with Cigna. So imagine somebody who doesn't really work at Cigna. And the reason is because no one likes to talk healthcare, right? And given the importance of women in the household where most healthcare decisions are made by women, health plans have historically failed in being a trusted partner to women in their most vulnerable times, right? So you're talking about 9, 12 months in a lot of women's lives, where especially first-time moms. So it's a very vulnerable moment. And payers usually don't even know that their member is pregnant, usually until they give birth. It's actually fact. It's actually scary. There's like a global bundle, and unless the mother gets admitted into a hospital or something bad happens where a claim hits, there's a global bundle. And so after the woman gives birth, that's when the insurance company gets billed. So most times we don't even know that someone is pregnant until after the birth, right? And so this is in addition to the fact that we need to solve all the problems with women's health and the cost and how it's so terrible. If you know anyone who's gone through that experience, it's a very, very broken process. There's also a long-term reason why, as a health plan and as a partner to people, we need to find a way to solve the problem. And so we've been spending a lot of time in the women's health space, everything from like fertility through prenatal through to like labor and delivery to postpartum, kind of extending. And there are several companies that we've seen as well. But that's an area where I think there's a general kind of organizational wide interest in trying to make sure that we add at least one or two companies in our portfolio for that.
Very cool. I have a couple more questions, but if others have questions, feel free to drop them in the chat, or feel free to come off mute or raise your hand. The other question that I had was kind of how you think the diligence process for a healthcare investor might be slightly different from a traditional VC, or even from like a healthcare investor that doesn't have this corporate arm attached to it and is looking for like the specific value add to Cigna.
Yeah. So I mean, I think it's painful, right? And it's a B word. It's very bad. And the reason is because we do all the traditional financial diligence, all that stuff, right? But we have to find a way to, a lot of times, convince someone who is on the business side that there's a theme that may happen 5, 6, 7 years from now that they are not aware of. That's coming. And that the best way for them to play it is that we make this investment, which allows us to have an asset in that space. And you're trying to convince somebody who a lot of times has worked in a health plan for 40 years, because usually folks who work in health plans don't leave often, for a lot of good reasons. As you're trying to, and then two, you're trying to convince somebody who also thinks every year, right? So they have their annual P&L and they have to book it. And they are not thinking year 3, year 4, year 5, right? That's when the time comes, the time comes. And so the biggest challenge that we have is that initial 1 month or 6, 7 weeks of convincing, really getting comfortable with our thesis in an area and convincing the business unit to come along. Once we kind of clear that path, the rest of our process ends up being very straightforward. The problem over the last 6 months for us is that why we've only made one investment this year, which is not great, is that the market is moving so fast that you are not going to have 7 weeks, right, of time to convince somebody. Like by the time you come back, the deal is already done and folks have moved on. But I think that's the biggest challenge on the corporate VC side, in my opinion, is that there's a lot of because like without the strategic value, a lot of times money is money, right? Regardless of where it comes from. And so and what we don't want to do is to invest in a company, be on a board, and then our business units end up not using a company, or business units end up using their competitor, right? And so we really front load a lot of that kind of getting aligned strategically and getting them excited about the company the same way we are, and then dive into the process like any other traditional fund. And then like during our diligence, we will talk to other health plans, we will talk to customers, we'll do exactly everything that everyone does.
Just for the clarity there, in terms of process, like do you identify the company and then go to the business unit? Do you identify a market and then go to the business unit and then try to find a company? How does that process work?
Yeah. So for instance, one space that I'm excited about, and I think health plans and Sarah, you all should also look at it. But if you think about it, sleep, right? It's sleep management. If you think about the makeup of a human being, right? You eat well, you eat well, you exercise, you take care of yourself emotionally, and you sleep well, right? Those 4 things are so integral to healthcare. Like that's healthcare, right? Every other thing, it's not really healthcare. And health plans haven't really done a good job of sleep and managing sleep, even though it probably, obviously, all these things are also connected, right? So somebody who doesn't sleep well usually doesn't work out, and usually ends up maybe potentially getting kind of being emotionally depressed as well. And so they're all connected. And so in the sleep space, we basically kind of pick the space where we say, no, sleep is very, very important. And so what we are doing now is basically identifying stakeholders across the enterprise and saying that, you know what, these are the 4 or 5 people that we think we have to convince that this space is important. So we had a first call with them. We're on the same page that this space is important. And now we have another call with another team that spends more time on the product side. And the whole idea is basically convince them that our view of the world around how the problem should be solved is actually the right view. Sometimes we go into those calls and they actually convince us that we are wrong and what they are thinking is right. But that's the point of it, is that we're having a conversation with someone and agreeing on what the right path is. And then once we align on what the right path is, we go out there and we are very, very kind of targeted list of companies who may fit in. We bring them in to talk to the businesses. A lot of times 1 call, 2 calls. And then usually after those 2 or 3 calls, kind of align on one and then get very aggressive. Sometimes you get very lucky where you can line that well with the round because the company is already raising a round, so it lines up well. Most times it doesn't. And so what would happen if the company is not raising a round is that we still help them out, right? We still help them figure out a relationship with Cigna and all that stuff, kind of really paying forward our help, right? Proving that we are a helpful kind of strategic partner. And in this market, companies raise money every year anyway. So a lot of times you only have to wait for about 6-7 months and they'll be in the market. And then kind of do it that way. And then when they're in the market 6, 7, 8 months from now, you've already demonstrated your value to them and can be part of it. But that's when we kind of work together from the get-go in picking a market of interest and then delivering an investment after that.
Great. I want to pause in case anybody else has questions for Kwasi at this point. I can certainly keep going with mine, but anybody want to jump in? Yoga, do you source potential investees through universities?
So, and by invest, you mean a company that we're going to invest in, right?
Correct.
Got it. So we have historically not, and the reason is not because schools don't have smart people, because again, all the smart folks are in the schools. The reason is because we historically have been a late to venture fund, right? So usually doing Series B and later. And typically the person who runs a company, a Series B company, is not in school. Or either was in school and then quit and then now, right? We are starting to do a lot more early stage. And so one of the initiatives that we had this year was that we want to do a lot more Series A deals. I think that we will continue to go upstream. I think that we may end up at some point doubling into doing some seed investments. But so ultimately, as we do more earlier investments, we would have to figure out a partnership of sourcing through schools, right? Other funds, a lot of funds do it, right? I think like Canaan has one. And there's another, was it first round that has one? Yeah,
first round has
yeah. We all have it, but it's a great model. And at some point, if we do seed deals, we would have to figure out a way to source some schools as well. But now we don't.
Are there any, just to maybe elaborate on another interpretation of that question, are you looking at potential technologies that come out of university? So not necessarily teams that are still in university, but technologies in healthcare that have been produced by the University of San Diego or something like that?
Got it. So generally, no. And the reason is because a lot of times the technology ends up being on the sciences, right? Usually some diagnostics, a therapeutic, and med device, and we don't invest in those. We did invest in Clearly, which in some way is kind of came out of Cornell. And the guy who invested in the CEO he's a researcher who spent his entire career researching the space and kind of developed the product. And so you could think about it that way. But because we are mainly doing services and tech deals, like general tech deals, most of the time they are not being sourced from like university, like how like a biotech medication that gets created in some lab in like Johns Hopkins, right? We are typically not looking at deals like that.
Got it. I have another question, but others, please put any questions into the chat or go ahead, Anne.
Yeah, thank you, Sarah. Hi, my name's Anne. I work with NYU in their incubator programs. My question, I guess it's 2 parts, because currently we're trying to push a lot of faculties, especially in the Langone Health Center, to create their venture based on their technology. So my question for you, I'm not sure if you have worked with university ventures coming from university, but how does a venture fund deal with university holding a chunk of their IP?
I don't think it matters. So like in my old fund, we invested, when I was at the Blue Venture Fund, I think we invested in a bunch of, I think there's one that we invested in called Thrive Early Sciences that got acquired like last year. and I think Hopkins owned a lot of it. Hopkins Ken owned a lot of it. I don't think it. I think it does. It's like any other kind of investor on the cap table. And as long as they're being helpful, I don't think investors care as much. And so as long as they don't own too much of it to actually control the company, right? If an investor owns 5%, they're a minority investor like everyone else, and people usually don't care. But as they own more and more, I think that is a red flag, because you don't want your company's vision to be 100% determined by an academic institution. But yeah, I don't think it matters as much. I think if anything, like investors who think long term probably like it, because it allows them to start building relationships with the investee, right? So there are probably some schools in America that have been a great pipeline for some of the more innovative technologies, and so being on the same cap table in that case potentially could help you build a relationship with them, with their tech office, which means that as more and more opportunities come up in the future, you may be well positioned for those. So at least when we did the 2 deals, a Blue Venture Fund, it didn't even come up.
Sounds good. And the second part, I guess IP is part of the characteristic of university-generated ventures. Is there any other red flags that you wish, when the faculty are forming a venture, had thought about before moving forward with the venture? So more on accelerator
would you mind asking that again? I missed that, sorry.
Yeah, to reiterate, IP is part of the bigger issue when deal with university-generated healthcare ventures. Is there any other thing you wish the founders would know when they're just forming a venture, turning their research into business? Is there anything else you want them to figure out before coming to you with the company?
Yeah. Again, this is like a little bit out of my comfort zone, but I'll try. But I may lie to you, just so you know. So but I think one of the bigger things that we see, especially with companies who are going through the life sciences path, right, whether a diagnostic or a med device, the biggest challenge that we see is that a lot of times they get too excited about the tech and the IP, and they spend less time on the reimbursement pathway. I think that we see so many great entrepreneurs, especially in life science and med device, less so of therapeutics, who they love the IP, they love their tech, all that, and they think that ultimately health plans are going to pay them because they have a great tech, and health plans really don't care too much about your tech. And so as you begin to kind of set up studies and do all those trials, making sure that there's at least one health plan, a CMO from a health plan who is on your advisory board, who is giving you some advice around the things that health plans are going to look at in order for you to get paid. I think that is so important. There are so many kind of assets that have been grandfathered because they go through the entire process. They get an FDA clearance and they think that, oh yeah, we have FDA clearance, the health plan should pay for it. And you're like, no, that's not how it works, right? We have all these other things that we want you guys to spend time on. And then that means spending another 5 years trying to answer all those questions, where whereas 5 years ago, you could have received that feedback and kind of integrated them as part of your studies. So that would be that was the first answer that came to mind, I guess.
I will add to that, actually, Kwasi. We've looked at a lot of like faculty-led or researcher-led businesses, and I think the single biggest misunderstanding on their side is that as soon as the technology's done, everything just becomes easy from there. Like that is not the end of the process whatsoever. There has to be commercialization, monetization, like actually grow things from that point. And so it totally makes sense from the standpoint of, somebody who's in academia or who's in a lab to say, like, this is now the perfect solution and everybody's going to want to buy it. And we have to come in and kind of be the bad guys and say, like, there's a lot more to it than that. So like, you have to bring in a business person, you have to bring, and like letting go some of the ownership of like how this is going to be sold and marketed. I think if faculty or researchers are prepared for that upfront, it doesn't come as much of a blow later on when we come in and say, well, you've only just gotten started. So I want to go to some of the questions in the chat. Neil, how is Cigna Ventures trying to manage the rising valuations that are becoming more prevalent in health tech?
It's a good question. I don't know. I think ultimately, right? I think there are two ways to. My personal opinion, folks. I think we talk about this topic every freaking week, and we still don't agree here. I think there are two ways you solve it, right? One way you solve it is by saying that we are going to stick with our Series B investment later, but the market is the market, right? At the end of the day, if we all wake up tomorrow and decide that coffee, and this actually happened right now, like so there are some spots where cold brew costs freaking $6, and we still pay for it, right? 20 years ago, I'm sure we all would have said, I'm not paying $6 for coffee, and then they also guilt you to kind of tip them, which takes us like $8. And so at some point, the market is the market, right? And if everyone is paying X, that is the value. And so you kind of have to. It means that your returns will kind of come down a little bit, but the market is the market. So that's one perspective, and we've seen some funds do that and still pay high prices, because at the end of the day, you have to deploy money, because in the fund you make money by deploying money, right? The management fees a lot of times you earn them when you use the money, so you just don't add the 2% because you raise the fund. So that's one perspective. Another perspective, which I think our team is probably leaning more towards, is that ultimately you want to own a certain percent of the company. And so one way to not pay too much for it is to take a lot more risk, right? So you can wait till it's a Series B asset and it's de-risked, but guess what? You're going to pay very, very high for it. Another way to pay the same amount of money is to take more risk. And so rather than waiting at a Series B round, that's why I said, now let's go Series A, right? So let's take on more risk, which means that we get to pay the same amount of money that we would much rather pay, own the same percentage, but have a lot more risk, because the chances of failure is much higher. I will not be surprised if next year we start doing seed deals, because the same thing happens again where we're like, shoot, like we need to get into deals, and the only way we're going to get into deals is to go in earlier. But I think those are the two pathways. There are lots of funds who are still deploying capital at the late rounds. We are probably trying to do more of the latter, of this, go in earlier, take more risk, but that you much rather do that than kind of overpay in a market that's been hot for a very long time.
Great. Topher, it feels like hospitals and health systems are inundated with technology solutions for various elements in their value chain, and they can't all be winners. How have you seen companies differentiate their value proposition and stand out amongst the crowd?
Hospitals are tough. Hospitals are like, I spent like 2 years in advisory, but hospitals are the toughest. I mean, their models are set up. I mean, if the hospital does 6-7% of operating margin, that's like the best of all time, right? They have a huge capex. The hospital business is tough. And then in addition to that, another subtle thing about hospitals is that the most powerful people in hospitals are the doctors, right? It's not whoever, right? The doctors generate money. And a lot of times doctors also don't like change management, right? And so in addition to the fact that the hospital may not be able to afford it, the person who you're trying to change to use the technology, it probably also doesn't want to change. So it's a very tough marketplace to go into. I would say that when it comes to selling anything to a hospital, rather than spending time with the administrators or the people who have the fancy C in front of their names, go to the doctors and go to the people who actually use it. They are the most powerful people. They usually, if they want something, it happens. And then the biggest challenge again is the change management on the outside. And if a doctor, if let's say the cardiology department within Mount Sinai is willing to use the technology, trust me, Mount Sinai is going to make it work. And so I would probably kind of focus more on the actual, if it's a clinical product, I'll probably focus much more on the clinicians who actually use it, and making sure that you are building a company in such a way that they will be comfortable changing. Otherwise, you're going to struggle if the buy-in from the clinicians isn't on. Yeah, don't waste too much time on the chief strategy officer and the chief or the fancy chiefs inside in the health system. It's my personal opinion.
Great. From Aaron, what do you wish you had known that you know now when you began in venture capital? And how do you spend most of your time at a principal at Cigna?
So the second question is easy. So I'm going to answer that first, and then hopefully we all forget the first one, and then we come. But so we spend a lot of the job is, I think venture has. You think about venture right there, like that. At least I think about it in like three components, right? There's new deals. There's making sure the companies you've already invested in are doing well, and then you obviously always have to deal with your LPs. We obviously spend a lot more time with LPs because we're a corporate venture fund. Maybe there are some funds that are less strategic, so may not spend as much time, but that's like the third component. The first component of it, which is the new deals, the marketplace is very competitive, right? Relationships matter a lot. Like most of the deals that we've done, I kid you not, they are not deals that we did because we found a company online. They are deals that we did because the founder who you met 5 years ago or 3 years ago, or a founder who you've been helping out, say, hey, by the way, there's this other company raising money. I think you should talk to them, right? So relationships matter a lot because ultimately money is money, and no one really cares about your money, right? So if people like you, they usually want you to work with you. The second aspect of kind of the new deals is also kind of thesis building, having a very strong opinion about what's going to happen in the future. You also have to put yourself out there, right? Ultimately, this is an industry where you don't need 100 exits to be a successful VC, right? To get 2 really good exits, you're fine, right? For the rest of your life. And the way you get 2 really good exits is by putting yourself out there, right? It's by really having strong opinions. And you're going to be wrong most of the time, but at least you have a strong opinion. So like I was grabbing drinks with my partner at work who is in Chicago. We're talking about like employer paying healthcare insurance, right? And we're like, it's going to change, right? In 10 years, the way we've done healthcare insurance with employers has to change, right? High deductible health plans have been so stupid for a lot of reasons. Like, what is going to happen in 10 years time? Who knows what is going to happen in 10 years time? But you can only play the game when you put yourself in the game and have an opinion and invest in the company. And you'll probably be wrong, but at least that's the mindset. And so for me, as a principal, I spend a lot of my time on the new deals part of it, right? And so thinking about things of 10, 15 years from now, building relationships with a lot of founders and other VCs. Once we invest in the company, you kind of sit on the board. To be honest, VCs at the Series B stage aren't as helpful as like Sarah's team is, right? They actually help out. We just go there every quarter and just go complain about random stuff. We are not as helpful now. We may be helpful with an intro here and there to executives, but outside that, we just complain about the company. We don't run the companies. The company CEOs run the companies. The team runs the companies. So it's really just like staying out of their way and being as selfless as possible. And then on the LP side, it's usually not the most fun part of the job, right? And so, yeah, that's usually how we spend a lot of our time, really on the new deals and the new where the world is going 10 years from now, and trying to make bets to align with that thinking.
Anything you wish you knew?
Yeah. I think that if I knew that I like healthcare this much, I probably would not have gone into investment banking. I probably would have gone straight to working as a chief of staff after college, or as a chief of staff for a founder who I respected in a company space that I love. So like, if you love kind of like the MSK space, right, go call Andrew at Hinge and say, hey, by the way, like I want to be, and not the Hinge app, like the Hinge MSK company, and go tell, hey, like I want to be a chief of staff, right? I want to learn about what you do. And I would have done that and probably spend the last 8 years. I'd have probably spent the last 8 years working for 4 amazing founders who have built incredible companies across different parts of the healthcare industry. Like I wouldn't have, banking was great, But I really don't know how much of banking has been that helpful. And I would have probably spent more time just working with great entrepreneurs and founders to better understand healthcare.
Well, from Topher again, do you feel healthcare investing is more difficult to get started in at an entry level due to the complexities in the care, insurance, and delivery ecosystems?
No, I don't think it's any. I actually think it might be easier, right? Especially if you have a real interest and you've demonstrated that real interest. And the problem is like there aren't a whole lot of people who grow up wanting to work in healthcare, right? Like when I was picking groups in banking, healthcare wasn't one, and I'm not even gonna. Healthcare was like four. I picked the sexy stuff, right? I picked TMT, I picked left fin, picked M&A, and then I think healthcare. And then I didn't get into the top three because everybody else wants to be in TMT and do cool software deals. So I think that healthcare, if you have a true interest, the most important, the first step is to demonstrate that interest, to let people know that you really, really like healthcare. And I think that I actually think that because of just the number of people who want to go into healthcare and I don't know your age, so I'm not gonna, but like at your age, isn't as big as you think. Who want to go into healthcare VC, right? Most of your friends probably would much rather go do like consumer VC than healthcare VC, right? So I don't think it's any much harder.
I also think
is that a word? It's like any
harder.
Much? That made no sense, right? Yeah, I don't think it's harder. Any much? Yeah, I just about it any much.
I would also say I think don't be fooled by any healthcare investor who says that they know everything about healthcare. Like nobody that's investing in healthcare knows every single reimbursement code, every single like small piece of the healthcare system. And so I think you become an expert in what you get to know best, and you get some of that expertise through working with companies and having them figure some of those things out. But something like Cigna certainly has a lot more muscle there than a little fund like City Light that understands some things well, but not all of them. I know we're coming up on time here. Any other last minute questions, please put them into the chat. One of my last questions was around just how do you measure success of the companies that you invest in? So there's obviously the financial side of things, like, is this generating value for you? But how does Cigna think about, like, does this product actually work? And are we seeing an impact on our members as a result of us making this investment?
That's a good question. The strategic value of the investment we do, I think it's what we've told our investment committee is what I'm about to tell you. I don't think that it makes sense though, but like what we've told them is that we measure strategic value, one, based on the number of business units who are working with the company we partner with, based on the number of Cigna members who are working with the companies we partner with, and then based on how much dollars flow from Cigna or from our employer clients to the companies that we partner with. So that's a huge part of that. Another way that we've told them that we measure strategic value, and this is kind of like out of our control, right? Because sometimes we may invest in a company knowing that at some point we may acquire them as a company. It's kind of like Optum, right? And I know Optum Ventures and Optum aren't very tight, but Optum Ventures acquired like Able2, and Optum acquired Able2, and Optum Ventures was on the board, where it was an investor. But like, and so that's also another strategic rationale where like our first exit that we got was with like MD Live. Cigna, Evernorth acquired MD Live, and we were invested in MD Live. So that's also another kind of strategic value for why we need to exist. But I think that's out of our control, right? Because the corp dev team does that. But I think a lot of it kind of comes down to just how much business, how much revenues, how much of our clients and employees are using a product. To be honest, I think that's a stupid metric, right? It's like ultimately I don't like. I think it's kind of stupid because I think it should be one thing and one thing only. If we're investing in companies that are relevant to Cigna and they are generating strong financial returns, that should be a good investment. Then the question then becomes, is there a reason why our business units aren't using those companies, right? But like our goal should be invest in any company that's within the ecosystem of Cigna that is going to generate 20x returns. That should be our job. It's the business unit's job to go work with those companies. I think a lot of the responsibility of partnership also comes to us, even though we don't control what the business units end up doing. But that's how I would think about it. I think it should be solely based on returns, but it's not.
I would say for the companies that we're invested in, obviously we're interested in making people healthier. Is Cigna looking at some of those metrics at all?
To be honest, no. I think it's kind of implied. We kind of implied in our heads that, you know what, like the companies that kind of end up being successful usually ends up being companies that are generating strong returns. And so the nice thing about healthcare is that you can sometimes lie to yourself that financial returns means that the company is having great kind of healthcare outcomes. But we haven't really tracked those. We started kind of tracking some like diversity stats at the executive level, but still not very rigorous. But we haven't tracked anything from a health outcomes. We just assume that correlates with revenues, which it doesn't always.
Fair enough. Well, I know we're at time. Thank you, Kasi, so much for taking the time to talk to everybody today. I will see everybody on Tuesday of next week. As a reminder, next week, since it's the holiday, we have Tuesday and Wednesday rather than Tuesday and Thursday. Any other questions, please feel free to send to me. I'm happy to pass anything along to Kasi. And have a great weekend, everybody. Take care.
Thank you so much.
Bye.